Are you in an office that is still taking alginate impressions? Alginate impressions are always going to be something that we can fall back on utilizing, and in the sense if even if we're using a 3D scanner, because what if the 3D scanner ends up not working, or there's a glitch in the computer system, as we all know. So if you have a gagger that is gagging, or you're not sure and you're learning how to handle getting that patient through that uncomfortable appointment with the alginate impression, this is a topical anesthetic spray. It's cherry. I personally think it tastes terrible, but it really helps someone if they're gonna gag, especially with that maxillary impression. So it's an aerosol spray, so you can spray it towards the roof of the mouth before you take that alginate impression, about 3 pumps, have them close their lips, breathe for about 30 seconds, and the roof of the mouth becomes numb, and then the impression process is a little bit more comfortable for them. Also, what helps actually is just green Listerine. So green Listerine has that high alcohol content. If you get that little burning sensation, that helps as well. Another trick to a successful alginate impression appointment is start with the mandibular. Start with the lower impression. Of course, as we know, it's easier. So if a patient has a gag reflex and you get the lower done, you're already halfway there. If you start with the maxillary impression and they gag and become very uncomfortable and they have the watering eyes and now their stomach is upset, more than likely they're not going to have too great of an experience if now you have to take a lower impression, even though that we all know as dental personnel that is the easier one. So start with the lower, use your topical anesthetic spray if you need to help alleviate that gagging.